Hi, I'm Dr. McClurg with Ascentist Ear, Nose, and Throat Physicians of Kansas City. I just wanted to send a quick update on the COVID-19 health crisis from the perspective of an ear, nose, and throat surgeon. This is specifically directed to those healthcare workers that are on the front lines of this pandemic. As we are all aware, this virus is most frequently spread via nasal or oral secretions, whether it be from coughing, sneezing, or direct mucosal contact. This does make interactions and physical examinations on patients quite difficult. First and foremost, this does require treating almost all patients as a potential carrier of the virus until proven otherwise. No unnecessary nasal examinations or close face-to-face contact should be conducted on patients if at all possible. It should also be noted that there have been reports of aerosolized virus being present in the air for up to 3 hours after the initial cough, sneeze, or nasal airway manipulation. Due to this finding, nearly all elective ear, nose, and throat surgeries and procedures throughout the country have been canceled until further data and understanding of this virus can be obtained. Emergency procedures are still being conducted, but with the utmost caution and appropriate personal protective equipment. It should also be noted that many otherwise asymptomatic patients with loss of sense of smell or loss of sense of taste have been presenting to doctors throughout the world. Many of these patients have been found to be COVID-19 carriers without any other symptoms. Treatment of this condition is still unknown, but it does appear that the sense of smell usually does come back. For the healthcare worker that is on the front lines of this pandemic, extreme care should always be taken when potentially assessing or manipulating the nasal and oral cavities of patients. If at all possible, no manipulation should be conducted. If a nasal medication or inhaler is to be utilized on a patient, it is best done by the patient themselves. Precautions should be taken by the healthcare worker to utilize all appropriate personal protective equipment and to be as far away as possible from the patient during such events. There are multiple recommendations out there at various hospitals on what level of personal protective equipment should be utilized, so please stay up to date on the most recent guidelines at your specific hospital, as these recommendations do change on a very frequent basis. These are difficult and scary times for all of us, but as long as we can implement the safest and best treatment for patients while at all times protecting ourselves, we will get through this.